My chief complaint is that young man with tibia fracture and is unconscious. He fell from stairs and I beginning my trauma assessment. For this accident is trauma assessment. My equipment is ready, my son is safe. I am with a BSI. I have one patient and for the accident I consider stabilize the spine. And I need that help. My partner is imaginary and is hold the head for stabilize the neck. I begin in my assessment, my first assessment with ABC. First, for the condition, I I need to do or time the pulse. The pulse is lower. And now I need to check the airway is open, it's clear, no bleeding, no nothing. And I consider to maintain the ventilation because it's unconscious. My partner maintains the ventilation for the patient and I continue for the assessment. Now I check the chest. I need to inspect, palpate the chest. And I need to listen for sound, for sight. It's a little slow. Now I need to check the bleeding. Maybe it has bleeding for the accident. Check for the blood. No blue. Back. No blue. The leg. No blue. Now the circulation, the pulse. Maybe pulse. Slower. And it's low. The skin is pink, but is a little cold. I consider the patient need to do the as soon as possible transport for your condition. And I wait for the ambulance. I do the secondary assessment. First is the scan all body, beginning with the head, scalp, head, maybe bleeding or fluid, hair, the pupils good, nose, fluid no, the mouth is good because has the ventilation, and next is the neck. Need to check the SpH, maybe another complication. I consider to add the neck coil for stabilize the neck. I put that coil now, and after I check the chest again. Inspect, palpate, listen. One, two, three, four. The breathing is 29 breathing per minute. And now begin continue with the stomach, the 4 point, palpate, the abdomen is extended. continue with the upper and lower extremity in the pelvis. Check inspect palpate pulse motoring sensor. It's no motor sensor to the left and the right arm. Pulse motor sensory. It's not present. After pelvis. It's good. Left leg extremity. Pulse motor sensors no present. This leg, right leg, is the tibia fracture. Pulse inventory sensor is not present. And now I need to check the back. My partner helped me to move. I need to count 3. 1, 2, 3. Need to check maybe bleeding or something. All is good, fine. The spinal is fine. Bleeding or nothing. 1, 2, 3. Body is on the floor. And now I need to check again the airway, the blood pressure and circulation. The skin spin a little better the airway better than before because it is to maintain the ventilation. And now take the blood pressure. The blood pressure is 82/70. Now I need to check every 5 minutes the vital sign, and I need to transport. I wait for the ambulance. When the ambulance is coming, the ambulance is here. I need to do the appropriate report and say what is occurred, what is the chief complaint. The chief complaint is the young man fell from stairs and has tibia fracture, is unconscious. Now is the blood pressure 82/70, and the breathing is none is better 25 beat per minute, and I wait for the ambulance.